Your kidneys play an important role in keeping your body healthy by filtering waste and extra fluid from your blood. When they are not working properly, finding the exact cause is the first step toward choosing the right treatment. Blood tests, urine tests, and kidney imaging provide important information about how well your kidneys are working. However, they cannot always show the exact cause or type of kidney disease. In some patients, especially those with more complex or unusual kidney conditions, a kidney biopsy is the best way to make an accurate diagnosis and choose the most appropriate treatment. Before the biopsy, your care team will review your health history, medications, blood pressure, and blood test results. You may be asked to stop certain medications that can increase bleeding risk. Please follow the instructions provided by your doctor and ask questions if anything is unclear. A kidney biopsy uses a needle to remove a tiny piece of kidney tissue so that it can be examined under a microscope and studied in more detail. During a biopsy of your kidney, you will usually lie on your stomach. During a biopsy of a transplanted kidney, you will lie on your back. The doctor uses ultrasound imaging to identify the best location for the biopsy and guide the biopsy needle. The skin over the biopsy area will be cleaned, and medication will be used to numb the area. You may feel some pressure when the needle is inserted and the samples are collected. You will be asked to remain still and may be asked to briefly hold your breath. Usually, 2 to 3 small tissue samples are collected to make sure there is enough for testing. After the biopsy, you will rest and be monitored for approximately 4 to 6 hours. Your care team may check your blood pressure, pulse, urine, and blood count before you go home. Please arrange for someone to drive you home if instructed. And follow your care team's guidance about returning to work, exercise, heavy lifting, and other daily activities. A kidney biopsy is a well-established procedure that has been safely performed for many years. Like any medical invasive procedure, a kidney biopsy carries some risks. Fortunately, serious complications are uncommon. A large study that combined information from more than 118,000 kidney biopsies found that most patients recover without any major problem. The most common complication is temporary pain or soreness at the biopsy site. Some patients also notice blood in their urine for a short time after the procedure, which usually clears on its own within a day or two. A small collection of blood around the kidney, called a hematoma, can also occur. Yet many hematomas were small and were found only when imaging was performed. More serious bleeding complications are rare. About 1 to 2 out of every 100 patients may need a blood transfusion, and only about 3 out of every 1,000 patients require another procedure to stop the bleeding. Death related to a kidney biopsy is extremely rare. When it does occur, it is most often in patients who are already very sick or hospitalized with severe kidney disease, rather than patients having a planned outpatient biopsy. Your individual risk depends on your overall health, kidney function, medications, and the reason for the biopsy. Your care team will carefully review these factors before recommending the procedure. It is normal to feel nervous before a kidney biopsy. Your care team is here to support you, answer your questions, and address any concerns you may have before, during, and after the procedure. After you leave, contact your care team immediately if you develop severe or increasing pain, dizziness, fainting, difficulty urinating, fever, or a large amount of blood in your urine. Please remember, your care team is always available to answer your questions.